This is about transparency, key issues, challenges, and solutions. This is about our commitment to our community and our schools. This is DCPS News Now.
Duval County Crisis Line.
With every phone call,
the student threatens to harm himself or threatens to harm someone else.
And with every detail.
The student may have, had a behavioral issue, having an outburst that's uncontrollable.
They're helping students and saving lives.
In 2014-15, we had 6 suicides that year. And then this past school year, we've had 1.
This is the district crisis response team at work. They want to help the 1 in 5. That is the estimated number of students in the U.S. who have a mental health disorder. What's more is that in Duval County, 1 in 4 middle schoolers and 1 in 5 high schoolers say they've contemplated suicide.
I think a lot of people don't think of mental illness with children. And so we have to understand that everything that happens in society happens in the schoolhouse as well.
The team is a group of psychologists, counselors, school social workers, and more, all trained to help schools meet the needs of students so that they can do what they came to school for, learn.
No matter how great of a teacher you are, it does not matter to a student who is hearing voices. It doesn't matter to a student who's just witnessed a death of a peer.
It's work they can't do alone. They need teachers, administrators, and other school-based staff who know how to recognize the warning signs, which is where these sessions come in.
Screaming, throwing stuff, yelling.
Through the grant-funded Youth Mental Health First Aid Training, school-based personnel spend days learning how to identify mental health concerns. They walk through real-life scenarios like abnormal behavior and traumatic events.
It is common, but we just say, oh, that kid is bad, or that kid needs to be in timeout, not really getting to the root cause of why this certain student is commonly acting out.
The training kicked off in the 2014-2015 school year with the goal of seeing all educators trained by 2020. But participants aren't simply identifying symptoms, they're also learning how to respond. If you want to know whether it's working, well, leaders say the proof is not only in the numbers,
Duval Crisis Hotline,
but it's also in the phone calls.
We knew that as a result of the training that the crisis calls were going to increase. Because the more teachers that we trained, now we have people on the front line able to assess, and they're seeing all of these things that they did not see before.
And once school staff see a red flag, they're able to call the district's crisis hotline, available to schools 24 hours a day, 7 days a week, and manned by district psychologists. Since 2014-2015, the numbers of calls to the hotline has increased from 870 to nearly 1,500 last school year. But perhaps the most telling data is in the number of reported suicides, down from 6 in 2014-15 to 2 in 2015-16 and to 1 last school year. Evidence that a commitment to training staff and supporting schools is truly making a difference, one student at a time.
It could be the difference between life and death. It can also be the difference between graduation, not graduating.
It's not until we meet them, the students where they are, and help them to address their whole need that we can then address academics. Until then, that's never going to happen.